Okay, good evening, everybody. This is Jeff Berger, and I am your mental wellness gladiator from Cape Coral, Florida. And we are here resuming our Getting to the Root of It series with Dr. Georgia Balsley, the infamous Dr. Georgia Balsley, who is actually in Irvine, California. And tonight we are on series number, number 13, with the microbiome and Lyme disease. So we started this in April with leaky gut and autism and anxiety, depression, suicide, diabetes, cancer. So we're going to be continuing this into the new year of 2020. Lots of great things coming into the new year. But thank you all for joining us tonight. And I want to first state that we're really humbled to be partnered with the first holistic mental wellness company that focuses on the microbiome. And for those that don't know the microbiome, it's the gut-brain axis. And this is the huge science that is out there, and it is disrupting the health and wellness industry because everything really starts in the gut. The science is there, the clinical studies are there, and those of us, I'm pretty sure all of us that are on this are wellness partners for the most part. I'm pretty sure, but if you're not, welcome anyway. But we are really passionate about this humanitarian entrepreneurial tribe that we are a part of because we're making so many profound impacts with educating people as well as helping people from a holistic perspective. So with that, I'd like to introduce Dr. Georgia Balsley, who really resides in Michigan, but she's out in Irvine at a conference this weekend, and really humbled that she was able to take some time away from that conference and join us this evening. She is a daughter. She's a wife. She's a mom of 9 children. She's also a vet. Thank you for your service. And she is a naturopath for over 34 years and has been a tremendous, tremendous asset in this series that we've been building. And Dr. Georgia, before we start into the questions, please share with our viewers a little bit about you.
Oh, thank you, Jeff. Thanks for having me. I love doing these series and have to tell you, my first class started today at the Hormone Symposium, and guess what the topic was? Not only hormones, but microbiome everywhere. And so we know we're at the right place at the right time. And so I've been involved in complementary holistic medicine for a very long time. I am partnered with my amazing colleague, Dr. Zattel, and our office is inside the box, a functional medicine up in Marshall, Michigan. And what's really exciting is I am a traditional naturopathic doctor that involved actually through my children, and have taken off since then and seen patients from all over the world. But partnering with her as a medical provider, she can do things I can't. I can do things she can't, but together we can do great things in helping humanity.
Awesome. That's great. Well, thank you for sharing that. So let's just jump right in because we've got a lot to cover today, and we have a special guest that I'll bring on later on. But so the microbiome is, being studied, and it is the hot topic today, as you just said, hormones, so forth and so on. And it is really, a great topic these days because so many of us have been wondering, why can't we heal or reverse autoimmune diseases? And we're finding now that we can, all right? And that's the beauty of these series, is because we're thinking outside of the box of Western medicine. And so today we're going to be discussing about Lyme's disease, and with the gut microbiome, we're finding that it does have an impact on Lyme's disease. So share a little bit about what Lyme's disease is and where does it really stem from?
Gotcha. Yes. So Lyme disease is a tick-borne illness in which an affected tick carries a bacterium called Borrelia burgdorferi, or sometimes it can contain other species, but predominantly this in particular one, and rarely does it carry Borrelia mayani. Lyme is transmitted through the bite of an infected deer tick. And according to the CDC, Lyme is one of the fastest growing vector-borne infectious diseases in the United States. You know, it's interesting how our take here compared to abroad is viewed when it comes to different conditions and illnesses, as well as these vector-borne diseases. But Lyme disease is also found in Europe, Australia. Although the CDC states that Lyme disease can only be transmitted through the bite of a deer tick, the thought abroad is potentially they're looking at things like lice and mites and bed bugs and fleas, as well as mosquitoes, because they're all insects that actually feed off of blood.
Wow. Yeah, so that's very interesting, because I do notice that there, in some of the research that I did, Australia is pretty high
Yes.
with Lyme's disease, and it's really starting to, and in the United States, it's spreading like wildfire. And there, I did see a study as well as over the last, 20, 30 years, no, I'm going to say 10 to 20 years more on the progression of more people who are infected with Lyme's disease. So with that, there is an overwhelming amount of information that's starting to come to the forefront within Lyme's disease. And we know that an early acute diagnosis, generally you'll see symptoms within 3 to 30 days, but there's also a differentiation between early and chronic symptoms. So can you share what the differences are, the specific differences are from that perspective?
Sure. I wanted to go back just a bit because when you were talking about overwhelming, I want our listeners to understand when we mean overwhelming with a big O, right? There's more than 300,000 people each year in the United States alone that are affected by this epidemic. And they don't really truly understand because many cases go unreported and undiagnosed. So that's what is so disturbing about this in particular disease, because people, because of the symptomology Lyme creates, they're thrown into many categories and often misdiagnosed and mistreated because they're not getting to what we call the root of what the issue is. And so, due to the fact that when we talk about Lyme, and I don't know our listeners understand what Lyme is, but Lyme is a bacterium. It's a spirochete. It's this little spiral type bacterium, and it can hide very well and invade tissues. A lot of times without the knowledge of the host knowing that it's even there. And that's why some of these we call acute infections, these low-grade infections take place, and then we as general adults, we blow them off. We'll say we didn't sleep well, or I moved furniture and that's why I'm achy all over. I might be getting sick, that's why I'm carrying a fever. So we find excuses oftentimes. And so what's really disheartening is that some of the symptoms, especially in the early phase, people anywhere from 3 to 30 days after the bite can experience things like fever, chills, pounding or throbbing headaches, persistent noticeable fatigue, numbness and tingling, muscle and joint aches, swollen lymph nodes, facial or even Bell's palsy. That's where you have some paralysis in your facial droop. Some people mistaken that for a stroke. Or they experience what's called erythema migrans. It's a rash also known as that bullseye rash that we're noted for Lyme disease that we look for. However, many people don't experience that rash.
Wow. So with that being said, as far as some of the symptoms of it, it's my understanding that it's really difficult to diagnose Lyme's disease, and there are, and so why is this such a hurdle? And then also, why don't we have more tests out there to really focus and hone in on the specificity of the the ramifications from this disease?
Right, right. Well, Jeff, Lyme is not new. We think it is, and it isn't. It's been around for a very, very long time. In fact, one of the oldest human skeletons found, he actually, when they tested his marrow, he had Lyme disease. So the thing is that people could carry this vector-borne illness. However, their immune system can keep it at bay. I mean, we're exposed to things all the time. And so when a person gets exposed and they have what I read off, which would be the acute symptoms, they'll oftentimes go to the doctor and they present with 3 various different types of symptoms, and sometimes they don't even connect. So that's what makes it so difficult. And so when we listen to, a patient that comes in and presents with some different things, there are diseases that could actually mimic Lyme. And so then they're thrown into those categories instead of looking for Lyme disease in itself. So when we think about, okay, well, what kind of disease would be out there that could potentially even mimic Lyme? It'd be things like actually ALS, MS, multiple sclerosis, rheumatoid arthritis, lupus, polymyalgia rheumatica, fibromyalgia. And how many people do we know that have some stage of fibromyalgia? Chronic fatigue syndrome, Parkinson's, Alzheimer's, mono, depression, meningitis, SIBO, which is small intestinal bacterial overgrowth, Tourette's, irritable bowel, migraines, restless leg syndrome, and vertigo. Those are just some categories that people could be thrown in. And when they're treated with specific therapies, whatever their physician decides is best for them, and they don't get any better, oftentimes these individuals are put into these categories and often put on antidepressants, because what else is there, right? And so what's really sad about that is the type of testing we have, it's not very accurate. So according to the CDC, for a diagnosis of Lyme, there's 2 different types of tests they like to do. One is a ELISA test. It's looking for specific proteins. And then another test called the Western blot, which they recommend that you have 5 bands test positive. And if you test positive, well then, you have Lyme disease. The problem is that most people don't look at Lyme until later in the chronic infection state. And so oftentimes, because Lyme is considered a stealth pathogen, it can morph and change. And so the body the immune system's had to deal with it for so long. So oftentimes that diagnosis isn't concurrent. And the testing alone is 50% at best accurate. So we have all these cases of people that are not only misdiagnosed, but are not receiving the proper treatment they need. And it's just the best we have. I mean, there's some other tests that we can do, but even those tests aren't all that accurate. There's a polymerase chain reaction. It looks for small fragments of Lyme DNA. There's a C6 peptide test. It's looking for a C6 peptide in ELISA. But there's just, even in these tests, there are way too many false negatives. And it can be really disappointing in a person who's suffering all these different types of symptomology to not get answers.
Wow, that's a lot.
Yeah.
So, so you mentioned that there was two tests right now that are out there. Have you, through your practice and through, learning what's evolving in the medical field, are they doing any future new testing strategies to hone in on this, or is it just, it's like a catch-22? Because when you talk about you've got fibromyalgia and you got migraines, and you talk about, did you say MS? Is MS part of that?
I did.
Wow. I was just talking to a woman today who was diagnosed MS and was in a wheelchair, but today she's up and walking, and but she's doing it through her gut. And but so with that, and what are some of the drugs or the pharmaceutical protocols that people should be aware of, and just have an understanding of what these are doing for them?
So generally, if you were to get a tick bite and experience that bullseye rash, it's generally the standard of care is the word I'd like to use, is a single dose of doxycycline. That's an antibiotic. It's used for many different things, but doxycycline is a very common antibiotic that's used. What's really sad is there's really no recommendations for any children under the age 8 as of yet. So, you know, we have a lot of kids who play outside. We hope that they play outside, and we don't want to be afraid of being outside, but there's just really not anything out there for our little kiddos. And then, you know, what they consider the early onset. So, you know, when we talk about an acute tick bite, that's within 72 hours of the onset of that bite. So anything after that, they generally will do, you know, doxycycline again, just for a longer amount of time, sometimes amoxicillin, or some other different types of antibiotics. Those children over the age of 8 can be exposed to those medications as well. And then when we go into more of the chronic types of illnesses where they've, you know, the individuals had this issue for a long period of time, then they look at things like IV therapy. But you need to also understand, Jeff, is that without a diagnosis through these tests, these patients are not getting the treatment that they need because their insurance will not pay for an undiagnosed disease. So, you know, you're outside the box at this point.
Right.
So it's really important as a provider that when our patients come to us, they're coming with all these pieces of a puzzle, and they're giving them to us, and it's our job to put that puzzle together and make sense out of it.
Yeah, absolutely. And you talked about antibiotics, and I was going to say this, but I'm going to give credit to health coach Marie, because she put in here, antibiotics really mess up your gut, you know, for a very long time. And my understanding is that it could be up to anywhere from 6 to 9 to 12 months, if not even longer. And talking to people who are on antibiotics 2, 3, 4 times a year, compounding over the years, they basically have no gut. So it's just it's amazing. So we talked about some of the pharmaceutical protocols, but today with the microbiome project and with who we are associated with, there are some really great things happening in regards to gut health and brain health, okay? Physical health, mental health, in that respect. So share with the viewers what you've learned in regards to being able to focus on some really great holistic and plant-based protocols that address the certain areas within the gut that will help with potentially with the Lyme's disease, and moving forward from a dysbiosis state to more of a biosis state? Is that the right word?
Or homeostasis.
Homeostasis. Yeah. Homeostasis state. Okay.
So, you know, what's really important to note is and I'm just going to throw this in here. So for our viewers, next week, we're going to talk about the co-infections. We just have so much to cover in a short amount of time, but Lyme is just one of many things. So we don't want to leave out some of the other things that can come along with this dreaded one tick bite. But what we need to understand is that the gut holds roughly 80% of our immune system. So if we don't target that, how are we going to get any kind of resolve in any disease? I was talking to a provider today, and she was saying that's where I start. I start with the gut because it is the link to everything. And I totally agree with that. If we don't get the gut doing what it's supposed to do with good integrity, we're not going to have vitality and a proper immune system and be able to function really well. Most you know, the gut protects us from viruses and bacteria, and not to mention, you know, foreign bodies and chemicals. So that's one of the reasons why we really want to target the gut. But the other thing is that with the microbiome project and the science that is coming out of that, which is beautiful. I've been doing gut health for a very long time, but to see that the integrity of the microbiota in there and how it helps with gut integrity. So especially with patients with Lyme disease, often more so than not, they have very poor gut integrity. They suffer with leaky gut. They'll have chronic diarrhea or constipation. They could have gas and bloating, heartburn, reflux, abdominal pain. And they're putting it all together, but not even realizing, not in the combination with Lyme, but it's also, that you have a really poor functioning gut. And so with that, then they become nutrient deficient as well. And
Right.
then you start seeing, subclinical things like with the thyroid and your hormones and a whole list of other things. So, it's really critical that we focus on gut integrity and helping reseed the gut. The science is showing us that by boosting the immune system, helping to reseed that gut, we can actually help keep that vector-borne illness in check. So when I deal with patients, I focus on the gut, even though that we're trying to deal with the other thing. I have to focus on the gut so that they start absorbing better, they feel better,
Right.
they're sleeping better, all of that. So gut integrity is crucial.
Absolutely, and it starts with leaky gut, is my understanding. That's phase one, and if that's not repaired, then it just spawns off into a plethora of other autoimmune diseases, and then some. So,
Right.
great. We're coming up on to the 30 minutes, and what I'd like to do next, thank you, Dr. Georgia. And as Dr. Georgia said, that there's so much with this in regards to Lyme's disease that we are going to do a part 2 with this. And in that part 2, we will be talking about some of these other things that we've got going on here in regards to Lyme's disease. And I thought I put it down here in my little booklet here, but let's see. So in December, we're going to be talking about, we'll do a short review, and then we'll talk about other testing, co-infections, what she said, and there's a lot about the co-infections that we need to, communicate with you guys and gals, and then talk about more on standard care and more about the plant-based protocols. So, but with that, and we'll get really targeted on the plant-based protocols the next time, which would be December 5th. But thank you, Dr. Georgia, and I want to next bring on a special guest here, and it is Julie Richards, and Julie is Julie Griffin Richard, and she I'm going to read this, and there she is. So I'm going to let's see, Julie, and I'll unmute you and get you. There we go. You are unmuted. So Julie is from Cajun country, way down in Louisiana. So she and her husband have 5 beautiful children. I'm the first of 5, and I'm a twin, but and 2 amazing bonus sons and 1 grandson. So she is a retired 20-year chemical engineer and now has a thriving business as a nutritional autoimmune specialist. She loves the outdoors, photography, creating, and is passionate about serving women who have experienced trauma and providing them hope through holistic solutions. Julie's journey started decades ago. However, in 2007, took a sharp turn. Welcome, Julie, and please share your story with our viewers.
Thanks so much for having me. I'm so glad to be with everyone. So I always have to go back a little bit in time and give just a good foundation so that people understand the journey, because it's a long one. And so it helps people to understand a little bit what the past looked like, so we know what we look like now. And so, like you said, I'm an engineer. I'm a degreed chemical engineer. I fast-tracked through that education in about 4 years and started my career in a pretty large oil refinery here in Louisiana. And what that looked like is I climbed that corporate America ladder, right? And it was more of a fight my way up than climb my way up in that environment. And so think back, I'm 22 years old. I'm in a predominantly male environment, which is not a bad thing. I work in a pretty toxic environment in an oil refinery in Louisiana. Dr. Georgia, you talked about all these weird symptoms that people have. Something happens and then it just goes away for no reason. And so those type of symptoms started happening for me in my early 20s. And we didn't know what they were. I would go see a doctor for one thing and, oh, what's this? Here, take some medicine. It's gone. And then a year later, or 6 months later, something new and weird would pop up. And so I would go to a doctor to see about that. And so this was kind of that cycle that started in my early 20s. Now, I was pretty healthy. I ate well. I exercised. I took care of my health. But this cycle kind of just continued. And then in 2007, actually 2006, I had quite a bit of just personal stress that happened in my life. And then in 2007, things really, really took a sharp dive for me as far as my health. My body kind of started shutting down on me. And I was given that C word diagnosis in my pancreas. So at the time I was, I was not quite 32 years old. And we had 3 children at the time when I received that diagnosis. It turned out it was not that, but it was a very serious issue with my pancreas, which we later found out was an autoimmune condition. And so that was in 2007. Fast forward about 10 years, 9 or 10 years, we were seeing lots and lots of doctors, and we were spending a lot of money because we didn't know what was wrong. And so we were given all kinds of diagnoses. It started with the pancreas, and then it moved into fibromyalgia. It moved into irritable bowel issues. I had issues in my chest with the connective tissue. It was inflammation in there. And so it was just this cumulative effect of one thing after another. And so you can imagine all of that going on. By 2012, we had 5 children. I'm still working 50 to 60 hours a week. I'm in management in corporate America. And so by about 2016, my body completely shut down. And so I was running fever daily, and I was still working, trying to work at this time. But my performance started slipping at work, of course, because I was so sick. And so that was just my life, and it was not real great for sure. But I got connected in with a chiropractor, actually, and he did not diagnose me, but he said, my brother has this crazy weird thing called Lyme disease, and all this stuff you're telling me sounds like exactly like stuff he's been dealing with, so maybe you should get checked for it. And so that's where the journey with Lyme disease started. And I was diagnosed with chronic Lyme. You mentioned co-infection. So I have a couple of co-infections as well, Babesia, Bartonella, that we manage. And my doctor at the time, he actually, he started me on the doxy. And then very, very shortly, he moved into rounds of 5 different antibiotics all at the same time. And so it was a cycle. I'm sure you know all about it. And we started off on this because we just really didn't know, we really didn't have any other options at the time. And so about a month into that, we really, I was just not at peace with it because I knew I had all these gut issues, and I had researched enough to know that all these antibiotics are not going to be good for my gut. It's really going to throw me into a tailspin. And I was on like the chronic diarrhea type end of the spectrum. And so I always like to tell people I had an exact route to work. I knew where all the restrooms were that opened early. And so that was like my life. And so you can imagine kind of the anxiety that incurred with that type of lifestyle. I mean, it was not too pleasant on a lot of days. And so we had this kind of decision to make, like, do we continue with this treatment protocol? And the length of time that was recommended was about 2 to 3 years based on the length of time that I had had all of these symptoms. And so we're facing 5 different antibiotics for 2 to 3 years. And I just could not wrap my mind around doing that to my body. And so we started looking into and researching some more natural, holistic type treatment options. Now, did that cure and address all of the issues I had? No, it didn't. I did get a little bit better. And I would have like decent days, and then I had really, really bad days. And last year, I met an amazing chiropractor about 30 miles from where I live today. And I'd heard good things about him. And I said, you know, why not? What have I got to lose, right? I have seen so many doctors already. Let's try one more. And the first thing that he said was, your gut is a mess. We have to get your gut working better because it's just trash. And so that's the first thing that we started. He said, we're doing this, we're doing this. I had a very specific diet protocol that I followed, very strict. And that was the first thing he did. And he also said, hey, you have this thing called a vagus nerve, and it's probably not working very well. And so we're going to start working with it to get it working better. And that's going to help your immune system. And so that was my first introduction to this like whole gut thing. And wow, I have this connector called a vagus nerve, and it helps too. And so we did about 3 months of very intense therapy to address those things and really to support my body in healing. Now, did it work? Oh my gosh, I felt so much better. I was doing so well. But imagine 3 to 5 times a week of therapy. We knew we couldn't do this forever. And so that's when I was really introduced to this whole set of products that supports our gut so very well, and then supports the gut-brain axis and supports our brain. And I also I had major issues with brain fog. And as an engineer, you know, I had to think straight, and many days I couldn't. And so that was a huge issue for me in my career. And so that was kind of our journey into, wow, let's address the gut and let's fix it. And then let's see how things work with that. So it's been about 1.5 years that we've been working really strategically on gut health, on just really natural support for my body. Do I have bad days? I do. I had a bad day this weekend. But what I'm finding is that the bad days are much further apart, and they're not as severe when I do have a bad day. And so I just have one bad day. I don't have weeks of bad days. And the bad day is not as severe as they used to be. And so I always have to just be completely transparent with people. You know, is my life 100% perfect? No, it's not, but it's so much better than it was. And so as we progress, things just continue to get better, and those bad days continue to get further and further apart for me.
That's awesome, Julie. Thank you so much. Amazing story. I would like for you to share, because this blows my mind, because as you're talking, I'm like, oh, I forgot to, I took a snapshot of the picture and it's on my computer, and I was going to share it. But in your testimonial, you have a bowl with a bunch of stuff in it, and then another bowl with some other stuff. And by the way, I love your table display behind you. So, but share with the viewers, that previous bowl and that transition into this new bowl of stuff that you've got going on.
Yeah, so I have a bag that I actually carry with me when I speak to people that is actually all of my prior meds that I was taking. And so it includes, I didn't think to grab it before we hopped on, but it's got all those antibiotics. It's got sleep medication because you can't sleep, which is an issue, a really big issue with Lyme disease. Patients is they have trouble sleeping at night. And then they're exhausted during the day, but they can't sleep during the day either. And so it's just this awful cycle. You're wide awake at night, but then you're exhausted during the day, and it's not a good thing. And so I was on sleep medication. It made me crazy. I couldn't take it. And so, but I do have the bottle because I did take it some. Pain medication because I do like major joint pain in my hips and my legs and my feet, muscle issues with the fibromyalgia. And so I had a moment of inspiration one day once we started really addressing the gut, and I said, man, let me go pull out all of that medication that I used to take. And so I pulled it out, I put it in a bowl, and then I pulled out what I was currently doing. And so this was probably about a year ago that I did this. And for me, I know it impacts so many people that see it, but when I put all that out to see, I was teary. Looking at it, I still kind of tear up when I think about it. But yeah, such a huge transition. And let me say also for our viewers, things that I was already on from medication, that was not I'm taking it one day and I stop the next. And so I always let people know that you work with your provider to make a healthy transition into a different protocol. And granted, some of those bottles were vitamins, omegas, that sort of thing, but that was my daily routine.
Sure. And I just pulled it up actually, and I'm going to share it there. Do you see it all there? Do you see? Okay. So that's the before, and that is the after, which is just mind blowing. So, but that's super. So thank you so much, Julie. Really appreciate you coming on this evening. So what I'd like to do now is open it up. I'm going to open it up to Q&A. And
hey,
sure.
Jeffrey,
Yes.
If I could, I did want to just add one last thing
Sure.
for our viewers. If any of you are experiencing like these type of symptoms, stuff that doesn't make sense, and you've seen a lot of doctors and no one really gives you an answer, this is what I did, and it was very, very helpful as we began to kind of start trying to figure out. I literally sat down one day and I made a list on paper of everything that I had, and I put a date by it as best I could. First quarter, whatever the year was, if I couldn't remember exactly. And so towards the end, when I was seeing a couple of new doctors, I literally would go in and just hand them the paper. And so it was about 3 pages, but they had at least a view of, the last almost 20 years of my life of things that I had been going through. And so it really helped them to start putting those puzzle pieces together. And so I just wanted to give that little tip for people. It's really helpful for providers to see that overall view of your journey.
That's awesome. Yeah, great. That's a great point. And the more information that you have for your medical provider, the better, especially a history of that. So that's awesome. So thank you so much. What I'd like to do, we've got about another 10 minutes. And before I do some closing thoughts and stuff like that, I'd like to open it up to anybody who has a question. If you want to unmute yourself and throw on your camera, And if you can't throw on your camera, just unmute yourself and I'll trigger you to put on your camera. Please do so. Do we have any non-shy people out there? Don't be shy.
Jeff, I'm going to ask Julie real quick for our listeners.
Sure.
I know it was a journey for you. How many providers did you end up seeing before you finally got someone who thought maybe you should look in this direction?
Gosh, it was probably at least 15, maybe closer to 20, over the course of time that we went
Definitely
through.
not uncommon.
And that's probably on the low end. I'm probably missing some, but just off the top of my head, it was 15 to 20.
And I totally agree with the timeline. In working in functional medicine, that's what we do so that we can look for triggers. And it is really helpful to have timelines when you start experiencing symptoms, because it's too easy in the middle of a doctor's appointment to not remember some of the small things.
Exactly.
We have any takers out there?
Jeffrey, I have a quick question, if that's okay.
Go. Hey, yes, that's what I'm going to throw on the video. So there we go. Go ahead. Go ahead, Shannon.
One of the big questions I get quite a bit, talking about the microbiome and helping out, and I have a son and a daughter who went through it when they were little. Can you get rid of the spirochete? Does that ever leave your body? I've gotten that question so many times, and I have no idea.
So the thought is no, it doesn't. And so the goal is, because it's considered a stealth pathogen, and especially when you get some of the co-infections that we'll talk about in the next session, they've learned to be able to morph it to live and survive. Mm-hmm. So the main goal is to do all we can to try to eradicate what we can and help really focus on the gut and building that immune system so that you can live a good quality of life, pain-free, as best as normal as possible. Many people, I actually have a patient right now that had Lyme for numerous years. When she came to me, like Jeff was talking, years and years of rounds of doxycycline and other antibiotics affecting her thyroid and much more. And she's doing extremely well. And she has for probably the past, I'm going to say 15 years. So, the possibility is definitely there. It's just definitely focusing on that immune system and working on fixing that gut so that you have that warrior partner to help deal with this condition.
Okay, makes sense. Thank you.
Anybody else? Thank you, Shanna. Okay, I guess we got a shy bunch out there, but that's okay. That's okay. I hope everybody found value out of this. So what I'd like to do is, so generally this series is, we hold it every 2 weeks. So in 2 weeks, Dr. George is going to be in Costa Rica. So we're not going to have it on the 21st. We're not going to push it to the 28th because that is Thanksgiving. So we're going to push it out to December 5th. So that will be part 2 of Lyme's. And again, we're going to be talking, just do a quick review on Lyme's disease. We'll talk about other testing. We'll talk more into the co-infections, standard care, and then we'll dive into more of the plant-based protocols and target specific, programs that are available for you out there. And so let's see. I want to thank Dr. Georgia for your infinite wisdom and taking the time from your Irvine, California session and workshop this weekend or conference. Julie, Griffin Richards, thank you from the Cajun country down in Louisiana. Your story has moved, hundreds, if not thousands of people within the Amari global family. And I want to just say that this has been an honor for me to be able to do this series and be able to, educate people about what we're doing, why we're doing it, because we do have a purpose, and we have a mission, and we are warriors. I'm a gladiator. We're fighters. We are on a tribe of people who want to communicate a worthy message through love, integrity, innovation, service, and humility. Okay, and so with that, I hope to see you guys on the 5th, and wishing you blessings for this evening. And as I always say at the very end, sometimes I miss it, hashtag poop matters. All right, thank you all for coming, and really appreciate it. Have a wonderful rest of your evening.